We don't just breathe in oxygen and breathe out CO2. It's a mix of gases. The air we are used to breathing in only contains 21% oxygen. We breathe out about 16% oxygen. That's still enough to keep someone oxygenated for a while. We are also helping them breath out CO2. We convert oxygen to CO2. But not all of the oxygen in the air. Normal air has 21% oxygen. Exhaled air has 16% oxygen. So it still works because we're breathing out plenty of oxygen still. What if you hold it in for like a minute or two before you breathe it out? Is the exhaled oxygen content lower? Basically, the breathe in oxygen breath out CO2 line is an oversimplification. Your lungs turn oxygen into CO2. That doesn't mean they're 100% efficient at it. The air you breathe in is 21% oxygen. The air you breathe out is still 16% oxygen. This is why you can hold your breath for a minute or two. You still have oxygen in your lungs, just less than as comfortable. In the case of CPR life breaths, comfort isn't really your first prerogative. You possibly even broke some ribs during the chest compressions anyway. Greater than your lungs turn oxygen into CO2. To be clear, the CO2 exhaled by the lungs wasn't made by the lungs. It was made, as a metabolic byproduct, by all the cells in your body, transported to the lungs by the blood, and then dumped back into the air. It doesn't really, which is reflected in newer guidelines. There's more oxygen in air, so you're better off having someone hold the airway open and do chest compressions. Unless it's drowning. Mouth-to-mouth stimulates the patient to breathe and cough. But then try to use a mask, or else they will vomit in your mouth. You don't exhale pure CO2. There is just a little bit more of it in the air you breathe out. A tiny bit more, just a few % more. We also do not inhale pure oxygen. We don't breathe in oxygen and exhale CO2. We breath in air that's relatively rich in oxygen and breath out air that has slightly less oxygen and little more CO2. Mouth-to-mouth doesn't resuscitate someone. It's used together with chest compressions to restart the heart beating on its own, and to help oxygenate the blood. FYI, it doesn't restart the heart. It squeezes the heart in a way that manually pumps some blood, thus circulating blood slightly, thus providing some oxygenated blood to the brain and other organs probably, thus delaying the brain damage that would make resuscitation a moot point. Similarly, AEDs don't jumpstart the heart. They try to stop it from spazzing out when it's trying to beat, but instead ends up sort of spasming in a highly irregular fashion due typically to the muscles of one part of the heart failing to fire because of lack of oxygen. Source: I'm just some chump, but actually for real, look it up, it's fascinating. Human lungs are really inefficient in their design. As we breathe out, we have only used less than half of the available ox in air. Birds with their much higher metabolism have air sacs and lungs, and when they breathe the air flows through the lungs in and out the air sacs. Rebreather diving equipment uses the residual ox in exhalation to give longer diving times from same amount of ox compared to trad. Scuba gear. Of course the rebreather needs scrub the CO2. Because we don't breath in oxygen and exhale CO2. We breath in air which is about 78% nitrogen, 21% oxygen and 0.05% CO2. Then we exhale air with a bit less oxygen, about 16%, and a bit more CO2. Because we don't exhale one element only. It's a mixture. And I'm that mixture of an exhale. We also exhale oxygen. The percentage of oxygen in the air when we inhale drops when we exhale it. But alas, it's still there. Adding to this. This is also how and why an rebreather works. You inhale one last time and exhale into a bag, container. After that you use that air mixture to breathe, giving you some crucial extra breathing time in case of submersion. Helicopter crash. As others have said, we breathe out about 16% oxygenated air. Enough to keep someone alive. On a related note, many authorities no longer recommend mouth-to-mouth resuscitation. A lot of people are afraid of performing mouth-to-mouth because of special boundaries, and it's not absolutely necessary. Oxygenated blood has enough reserves to keep an unconscious, calm person going for a good 5 minutes before any permanent damage begins to set in, provided the blood is still pumped. Hence why many authorities nowadays only recommend doing chest compressions to keep the blood pumping. Others already talked about oxygen, but the other and more important part of CPR is that you're helping sort of jump-start the lungs by getting them to expand and contract, which can help with blockages and other stuff, but always remember to check the airway first. Additionally, the mouth-to-mouth part of CPR is falling slightly out of favor as chest compressions do all the heavy lifting. Jump-starting the lungs is not taught because there is very little, if any, research to support that. Cardiac arrest is not a lung issue, it's an electrical heart issue. Checking airway before CPR is not taught either. The overwhelming percentage of people who need CPR need it because of sudden cardiac arrest. Priority should always be starting compressions immediately. Breaths are just as important as compressions when it comes to individual survival rates. Again, this is what's taught in modern CPR classes. You do not breathe in oxygen and breathe out CO2. You breathe in air and breathe out air. Air has a varying degree of oxygen, CO2, nitrogen and other gases. The air you breathe out still has plenty of oxygen, just less than before. There are other gases in the air. Also, your body doesn't absorb 100% of the oxygen, and it doesn't expel 100% CO2. What it expels is still better to have in someone's lungs as opposed to them not breathing. The air you exhale contains almost as much oxygen as the air you inhale. There's enough oxygen in the air you exhale for the person you're resuscitating to be able to get enough oxygen to stay alive. It still has some oxygen, and it'll get the lungs to reinflate, like a balloon. Does it work? Is it better than literally anything else you can do without medical tools? Yup. It doesn't. CPR classes are now teaching compressions only CPR that does not include mouth-to-mouth. This not only lessens the chance of spreading disease via bodily fluid contact, but also the exhaling would include higher than normal amounts of CO2 due to the high stress of the situation. We breathe in a cocktail of gases with about 20% of it being oxygen and 75% plus nitrogen. We exhale a slightly different cocktail, which has about 15% oxygen instead. Thus, you still give oxygen when you make out with the victim who needs CPR. Now, Daddy's gonna drink a different kind of cocktail that helps him function. We breathe out enough air to sustain someone's life for a short amount of time. For a person to fully regain consciousness, they need more. We most breathe nitrogen TBF. Only a small part of the air you breathe is O2 and only part of that O2 is absorbed in a single breath. Because when you're giving someone mouth-to-mouth, you blow the air down the other hole, it reverses the process. Mouth-to-mouth is not only about inserting oxygen. It's about restarting the diaphragm's motion. Although in most cases, mouth-to-mouth isn't recommended anymore and CPR should just be chest compressions.